The federal government wants to crack down on the unvaccinated. President Biden announced sweeping new vaccine mandates yesterday. They affect not only federal employees, but also those working in private business and school children.
Well, the president's new mandates quickly generated pushback, with Republicans calling them unconstitutional and some states considering legal action. Caitlin Burke has the details.
These sweeping new mandates are expected to affect as many as 100 million Americans. The new rules requiring vaccinations not only for federal employees and any contractors who work for the federal government, but also private businesses.
The Department of Labor is developing an emergency rule to require all employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated or show a negative test at least once a week.
The president clearly expressing his frustration that 1 out of every 4 Americans who is eligible to be vaccinated still hasn't gotten the shot.
We've been patient, but our patience is wearing thin, and your refusal has cost all of us.
Dr. Anthony Fauci says Americans are still getting infected with the virus at 10 times the rate needed to end the pandemic. And the U.S. is headed into the fall with 4 times more patients in hospitals than a year ago. Now, Biden calling for an end to what he calls pandemic politics.
This is not about freedom or personal choice. It's about protecting yourself and those around you.
Some Republican lawmakers and union chiefs immediately pushing back against the new mandates, calling the president's actions unconstitutional. Some states are also already considering legal action. Kristi Noem, the governor of South Dakota, tweeting, quote, "My legal team is standing by, ready to file our lawsuit the minute Joe Biden files his unconstitutional rule. This gross example of federal intrusion will not stand." And Arizona Governor Doug Ducey tweeted out, quote, "This is exactly the kind of big government overreach we have tried so hard to prevent in Arizona. This will never stand up in court." Just last December, then President-elect Biden said he would not demand the vaccine be mandatory. The White House now saying the president's position has needed to change, along with the virus.
So obviously, information, data evolves, and the steps we need to take to address, to get the virus under control, to help people return to normal, has to evolve as well.
The president is also calling for regular COVID testing at all schools. The Los Angeles Board of Education taking things one step further, voting on Thursday to require all students over the age of 12 to be vaccinated if they want to attend in-person classes. Caitlin Burke, CBN News.
Well, our CBN News medical reporter, Lori Johnson, is standing by here to tell us more about this. So, Lori, the first question I've got, how in the world are these mandates going to be enforced?
Well, that's a great question, Gordon, because anyone who's driven on an interstate knows that if people don't want to obey a rule, they won't unless it's enforced. And at this point, it looks like OSHA is going to be enforcing this. And they say that they're going to be fining businesses $14,000 per offense. And so we'll see if that actually holds.
I've got to ask, as an employer of over 100 people, is that 14,000? What does per offense mean? Is that per employee who is unvaccinated? How do they count offenses?
That's what it sounds like. And the details of this were not laid out in the president's speech. And so there are a lot of questions, and a lot of employers, such as yourself, are consulting their legal teams and getting legal advice, because this is a huge legal issue on so many different levels. Okay, well, who's going to pay for the weekly tests? Within what I've seen in the news media, that you either have to mandate vaccination or require people to submit a weekly test that they're not positive. So who's going to pay for the test? Well, the president did say that businesses must pay for time off for employees who get vaccinated, and also pay for time off if that vaccinated employee is having some trouble, doesn't feel very well after their vaccine. Sometimes people need to take a day or 2 or 3 off after the vaccination. And so he made it clear that businesses have to pay for that time off. But it looks like if a person is opting out of the vaccines and is instead going to go the the weekly test route, that it is going to be up to the employee to pay for that.
Okay. Well, let's talk about Regeneron. The president is saying that will be made more available. So what is Regeneron? What does it do?
Regeneron is wonderful, and people who are regular viewers of the 700 Club know we talked about this a couple weeks ago. Regeneron is a monoclonal antibody. It is a treatment that is very effective, and it's widely available in some places, like in Florida. And we know that it reduces the risk of hospitalization among COVID-positive patients by 70%. So if you become positive, if you become sick with COVID-19 and you get this Regeneron or another monoclonal antibody treatment, then within about 1, 2, or 3 days of the onset of symptoms, then your chance of being hospitalized drastically decreases. And so the president said that the availability and the manufacturing of Regeneron is going to be increasing. He also said that part of this new effort is going to be increasing the manufacturing and availability of those tests, Gordon.
All right, last question. We're hearing a lot about the Delta variant. There was a Lambda variant, and now I'm hearing that there's a new one called Mu, and so I'm relearning the Greek alphabet.
Sorry.
Tell us about Mu. Should we be concerned about that one?
Well, yes and no. Right now, Mu has been identified in 49 states, but still, Gordon, the Delta variant makes up 99% of all COVID-19 cases, and it's absolutely ravaging our country right now. We're averaging about 150,000 cases a day, 1,500 deaths per day. And so health officials really have their hands full with Delta right now, although they are keeping an eye on Mu to see what it's going to do. Right now, there aren't that many cases. There are some early reports that in laboratories, in Petri dishes, that it is very contagious and could evade the vaccines. But also, we know this is true with Delta, that Delta somewhat evades the vaccines and is extremely contagious. So when people say that Mu could evade the vaccines, they're not saying entirely, but possibly somewhat. So their health officials are definitely keeping an eye on Mu, but much more concerned with Delta at this point.
All right. Well, Lori,